Before you begin, please take your time to read the following AQ about this survey. Why are we interested in the impact of the COVID-19 pandemic on the mental health of healthcare professionals? The COVID-19 pandemic emerged in a context of pre-existing tensions in the health field and amplified the health crisis in which you, the health professional, are on the front line. This pandemic has also impacted social and economic status in France. Personal or professional changes might as well have occurred because of this health crisis and might have affected your general and mental health. In order to understand the potential repercussions of an event on health, epidemiological studies are conducted. In France, studies about the mental health of healthcare professionals were rare before the pandemic and are still few in number. Who can be included in this study? Professionals or students who work in a healthcare facility in France that receive COVID-19 patients. Those included in the survey should have an advanced level of French or English and be at least 18 years old. The occupations included in the survey are medical professionals, physician assistants, pharmacy and medical physics, administrative and health-related occupations. How do we assess mental health in this survey? In this survey, we are using scales that have also been applied in other international studies. Such scales assess the presence of mental health symptoms frequently seen in distressful events or potentially traumatic situations. You will therefore be asked about the presence of depressive, anxiety, and post-traumatic stress symptoms. We remind you that your answers are anonymous. Not all questions are mandatory. It is desirable that you fill out as many questions as possible. You can drop out at any time. If your responses indicate symptoms, what happens? If your responses to the scales indicate the presence of symptoms, then you will see a box inviting you to contact a specialized professional and telling you what options or devices are available to you. We would like to emphasize one important point. These tools are not intended to diagnose a psychiatric disorder or to provide medical advice. If your responses to the scales do not result in the guidance box being displayed, this does not mean that you do not have symptoms of other disorders and does not preclude medical consultation if you feel the need for it. What other information will the survey collect? Other than mental health, you will be asked questions related to distressful or traumatic situations, such as your exposure to the pandemic, your working conditions, burnout, and difficult life experiences. There are many factors that might influence mental health, so we will address those that are known in the scientific literature, such as socio-demographic characteristics, employment status, general health, substance use, and personal and professional social support. Which information will be collected by the intervention? As part of the intervention, with PsyCStart responders, you will be asked to assess factors for stress related to your work during the pandemic and completing a self-report questionnaire. If you have a moderate to high risk factor, with the APD program, you will build a personal resiliency plan that will help you find personal resources and solutions. If you have any other questions, contact us at contact@psycover.org. Thank you for your attention and your time.